Hi everyone, welcome back to Baby Doc. I'm Dr. Smita and today I'll be talking about vaccination. So it's going to be a two-part series wherein the first part I'll be talking about the vaccination schedule in our country, and in the second part I'll be answering all the doubts and frequently asked questions regarding vaccination. So before we begin, I think it's important to know what a vaccine is and how it actually helps you. So vaccines are basically of three types: live, killed or conjugate vaccines. Now these are technical terms, but the basic thing is that whenever vaccine is given, it produces antibodies in your body, and they get stored in the memory. So in the future, whenever the person is infected or comes in contact with the organism, like for example measles or chickenpox, we have vaccines, and if the person is vaccinated and in future the person comes in contact with that virus, these memory cells, they get activated and they help in preventing the person from getting infected or getting the disease. Now certain vaccines, they require 2 or 3 doses for to achieving 100% immunity, and as well as booster doses, because these memory cells, they keep on reducing in number. And say for example DPT vaccine that we have, or even MMR, we require 3 doses. Certain vaccines you need a single dose, that is BCG for example, and in certain vaccines you require a yearly dose because the virus itself keeps on changing. That is for example influenza virus. So with this small background, let us begin today's video and talk about what the vaccination schedule in our country is. So on the screen you see the Iap Immunization Schedule that we follow in our country. Iap stands for Indian Academy of Pediatrics. At birth we give the BCG, that is for tuberculosis, the hepatitis B and oral polio. Now this is to be given within 24 hours of birth, or at least before the baby is discharged from the hospital. At 6, 10 and 14 weeks we have a variety of vaccines which we follow 3-dose schedule. And it starts with the DPT, that is diphtheria, pertussis and tetanus, the injectable polio IPV, which has now replaced the oral polio vaccine, the H influenza B, which Hib vaccine, which is responsible for ear infections, respiratory infections and even meningitis, the hepatitis B, and the pneumococcal vaccine, now which is for against pneumonia. Now except pneumococcal vaccine, the rest all vaccines come in a combined form as a hexavalent vaccine, that is this available in a single injection so that your baby doesn't have 6 different pricks. Apart from this injectable vaccines, we also have the Rotavirus Vaccine now, which is an oral vaccine and it's against the rotavirus diarrhea. Now there are 3 different types of rotavirus vaccines available in the market, and some of them follow 2-dose schedule and some of them have a 3-dose schedule. But whatever vaccine you give, the rotavirus vaccine should be completed before 8 months of age. After 8 months it is not recommended. At 6 months of age we have the influenza vaccine, that is for flu, which is followed by 2nd dose at 7 months. At 9 months we have the MMR vaccine, that is the measles, mumps and rubella vaccine. At 10 months we have the typhoid vaccine, we give a typhoid conjugate vaccine. Now in the latest recommendation they have said that we can give it anytime after 6 months of age, but I personally believe in giving it at 10 months or later. At 1 year we have the hepatitis A vaccine, which again there are 2 types. So if you give the live one, this is a single dose, and if you give the killed one, you have to give a booster dose after 6 months. At 15 months we have the MMR again, that is for measles, mumps and rubella, and the varicella, which is for chickenpox. At 16 to 18 months, or rather 15 to 18 months, there is the DPT, IPV, the H influenza B, Hib and the pneumococcal. We have a booster dose, which the primary schedule we already finished in 6, 10 and 14 weeks. And now they have recommended that varicella, that is chickenpox, 2nd dose should be given within 3 months of the 1st dose. So if you are vaccinating your baby with the chickenpox vaccine at 15 months, the 2nd dose is to be given by 18 months. At Now, 2 years, we have the meningococcal vaccine. Now, again, this vaccine is a special vaccine which is given. It's a costly vaccine, so it's an optional vaccine, and it's to be given where the meningococcal disease incidence is very high. And again, there are two different types of vaccine. So one vaccine is given at it follows a 2-dose schedule, given at 9 months of age, and repeated the second dose after anytime after 3 months of the first dose. And another type of meningococcal vaccine is to be given as a single dose after 2 years of age. So if there is a financial problem, or if the child is not staying in a very in an area where meningococcal cases are not much, I would advise that you give a single dose at 2 years of age. At 4 to 6 years come again the booster of TPT and MMR, that is measles, mumps and rubella. And now in the latest schedule, they have also included that along with DPT, we give the IPV booster also. At 10 years again, we have the Tdap vaccine, which is a variant of the DPT vaccine. Initially, we used to give only TT vaccine, but now we have to include diphtheria and pertussis also. Between 9 to 14 years, there's another special vaccine for girls, that is the cervical cancer vaccine, or the HPV vaccine. Now, if given between 9 to 14 years, it's a 2-dose schedule, and if after 14 years of age, anytime any girl has to receive it, it is a 3-dose schedule. And apart from this, another special vaccine is there, that is the Japanese encephalitis vaccine, which is to be taken in high-risk areas, or if you're traveling to a high-risk area, and it can be given any time after 1 year of age. But again, this you can discuss with your pediatrician, and at your liberty you take. These are optional vaccines, it's not a must. And other special vaccines like rabies and cholera, of course, are given in special circumstances, and it has to be discussed with your pediatrician. So this is the this is the Iap Immunization Schedule, wherein all the necessary vaccines are included. And these vaccination recommendations keep on changing. Every year there is a committee where they discuss, and wherein they say what vaccines are absolutely necessary, and even the dosing schedule is changed and the timing is changed. So you have to always discuss with your pediatrician before vaccinating your child. So that was all about the vaccination schedule, and please stay tuned for the second part, wherein I'll be answering all the doubts and questions. Please, if you have any comments or queries, do ask, feel free to ask. And if you've liked the video and found it informative, please do like and share on YouTube. Subscribe to my channel Baby Doc. Until then, take care and have a good day.